introduce the situation in South-Tyrol and the two theoretical perspectives I used in my research, and I will make some examples. At the end, a brief conclusion, and I hope that then is enough space for some questions. So actually I was supposed to make...
Sorry, just one interference short. We would like to record this webinar, so if it's okay for you to be shown in this webinar, otherwise we'll use the camera, okay?
Yeah, it's okay for me. Thank you for asking.
For everybody.
Okay. So actually, I was supposed to conduct my fieldwork in Leiden, in the hospital of Leiden, about the communication practices among anesthesiologists and patients. But I couldn't foresee that a pandemic will happen, and this caused a lot of confusion, and I needed to change my research topic. And at this moment in Amsterdam, the situation was still quite relaxed. There were no measures, and the crisis was perceived as something distant that you just know through media, or because you are in contact with people that are already in a hotspot or in a crisis area. And this was the case of Italy. As Stefan mentioned, I come from Italy, so I was in contact with my families and my friends, and from there I perceived that the crisis is happening in Europe. And this was, at the beginning, this was quite exciting for me. With my medical background and studying medical anthropology, I perceived the situation as a global medicalization. By that I mean that life itself became treated as a medical condition during this situation, and became a subject of prevention and studies and diagnosis, and in the end also of control. And this is something that was observable throughout the whole process of the pandemia, with different in different situations, with different things, and then I started to have extensive phone calls with these friends in Italy, and I decided that I want to do my research about this exciting topic, the isolation in Italy. I went to my supervisor and I asked her if she would agree, and she agreed on that, but she didn't agree on my next question, which was, would it be possible to conduct fieldwork back in Italy? Because I thought I have to experience this isolation and this whole crisis as it is in Italy. And at this moment, I think it was too risky for my supervisor to send a student to the most dangerous country in Europe at that moment, with the highest death and infection rate, and at that moment already the strongest implemented measures in Europe. So the situation changed quite fast, because the virus expanded or reproduced exponentially. So it was just a matter of time until the crisis expanded to whole mainland Europe, and subsequently also arrived in the Netherlands. So after some weeks, the Dutch government announced the first measures, and this was the moment where the Dutch Prime Minister went to the press conference and recommended to the people not to shake hands anymore. And in the next moment, he shook hands of another politician. So this situation was really emblematic for this whole crisis, because the virus and the consequences it has disrupted all the cultural and social structures and norms we learned throughout our lives and we practice since a long time. And this made it also really quite difficult in the beginning to acknowledge the risks and the dangers, and also to change habits. So after the first measures were implemented, also the crisis arrived in Amsterdam, and I experienced a lot of uncertainty. I was quite afraid what will happen. I didn't know what will happen next. What is the situation here? And I was always in contact with the crisis in Italy. So I kind of adopted the risk perception of Italy and applied it in Amsterdam, which was not congruent with the situation I was living there. So this was really stressful for me, and I didn't know what to do. So I reflected about the situation, and I came to the point that I need more control because in my eyes, and adopting the risk perception of Italy, in Amsterdam, people were not doing enough. So people were still going out, the restaurants were full of people, the clubs were open, even the red light district was still open at that time when in Italy already drastic measures were implemented. So I had the feeling I need to go back to Italy, where I have guidance, I know what to do, everything is controlled, and started to think about to move back. And actually, if I reflect now, this is quite irrational thinking, because I was in Amsterdam where the crisis was not acute. I could still move freely, and I wanted to change this with total crisis, the highest infection rate, the highest death rate in Europe, and the strongest implemented measures. But nevertheless, I decided for the second choice. And I asked my supervisor again after 2 weeks. I asked her for the first time. And also her perception changed. And that time she allowed and said, okay, it's good, you can go. So I moved back to Italy, and through my travel, it became evident for me that my behavior and many things in my surrounding changed decisively. So I myself, I took an airplane to go to Germany. And in Italy, I would live with my parents. Both of them are 65 years old. Thus, they are part of the risk group, or they are considered to be at risk of a COVID-19 infection. So I didn't want to bring the virus with me to them and put them at risk. So I did everything to avoid this risk. So I changed my behavior. I bought gloves, I bought the mask, I disinfected my hand all the time, even though I had gloves on. I attempted to maintain distance to other people. So this showed me that the risk to bring the virus changed my behavior decisively. And when I arrived in Bolzano, I was really shocked about the situation which was happening here. It seemed to me like in like a post-apocalyptic movie or something, because it was Wednesday evening and the streets were deserted, and I couldn't recognize the city where I grew up. And I think this was for me even more evident, or evidenter as people that live here, because I was still living a kind of free of movement life in Amsterdam. And here I perceived this shock moment. And people who lived here had this increase of measures and the crisis which slowly built up. So the people didn't experience this as a really big change. They adapted slowly, and then they didn't recognize it as like a really abrupt, radical change. And the last experience when I arrived home, normally my parents welcome me at the door warmly, and this time not. So I went there, I knocked at the door, they opened the door without saying anything, and they were standing next to each other with 1 meter distance. And they were looking at me really suspiciously. And then I realized that they were perceiving me as the risk which comes from outside and is intruding their home, which is considered as the safe space because the virus and the risk of the virus is not there. And they need to contain this order. This is something which I will come back later then. And in order to enter the apartment, they made kind of a cleaning ritual with me. So I had to go to the balcony and they disinfect from head to toes everything. Then I had to wash myself and all my clothes, and then I was permitted to be at their safe space, but with distance. So these were the observations and the experience I had that made me realize that risk is the major, or could be the major trigger of this pandemic. And then I started my fieldwork. I did interviews with 19 people. I recruited them from my acquaintance because it was the easiest way in this short period of time. And I needed also kind of a trust basis to speak with them, which is really difficult if you don't meet the people in person, or you speak to them in person, or can meet them, or yeah, like be physical contact just via mobile phone. So I started to conduct my interviews, and first I thought, okay, their life changed radically, and they will explain me everything about this and so on. But then they were not talking about big changes. They were just saying, yeah, our life now is at home, but we adapted to this life quite quickly. And this was really interesting to me, that they didn't perceive this change, and they just adapted quickly. Obviously, the life indeed changed and was disrupted especially by the isolation measure, and they needed to change their lives from one moment to the other and face different hardships. But nevertheless, people were quite resilient. So being in isolation myself was also difficult to conduct my research there, because in the beginning I was really excited, and like everything was data. So I was really excited, and being in isolation, it was like really a happening or something. Each time when the civil protection crossed my street, I ran to the window and I heard what they were saying and made picture, and everything was really exciting. But after some weeks where I adapted to this new situation, it became quite hard for me too, because I faced a difficulty, which was I was not only a researcher in this field, I myself was part of, or was experiencing in a quite similar way as the people that I was researching, a situation I was researching. So somehow it was really difficult to distinguish my normal life and my research life, because as I said, everything became data. This was quite exhausting and was also complicated while analyzing, because somehow I was observer, but became also the observed. So in the analysis, it was difficult to distinguish what is now my perception and my experience, and what is something that I'm analyzing for my data. So I wanted to focus on this life change then in my research, because as I mentioned, I was really surprised that people adopted so quickly, and that one trigger is enough to change the big part of the world within weeks. This was really incredible. So I wanted to focus on this to understand how this could be possible, with focus on the risk perception of people. So now this is how I came to the research. So now I will explain you a little bit about my exploration and my research, how people perceive the situation. So for me, there was difference between the beginning, which was starting outbreak in China, until the implementation of the measures, and then a second part which emerged some weeks after the implementation of the isolation, and then went on. So in this first part, people experience a lot of uncertainty and fears, and this uncertainty can be experienced as paralyzing, so that people don't know how to behave, people don't know what is happening, what should they do. So Zinn argues that in this situation, people start to trust in institutions which can offer people knowledge and skills to make these difficult decisions. And this is something that I observed also in the beginning phase. So my informants were all agreed that the isolation and the measures were necessary, at least during the beginning of the pandemic. And all of them expressed that they have trust towards the experts and the governments. And in some informants, this was also a new experience. They never experienced trust towards the government, but in this case, they did. And I observed that this is linked to this uncertainty, and made the whole trajectory of the pandemic easier for them to accept. So in the beginning in this initial phase, the experience of the pandemic was quite similar among the people. So they also like this common experience in fighting the same enemy, which was the virus, elicit solidarity among the people, which was expressed a lot also in media, with people singing on the balcony, helping out each other and so on. Which then also was transformed by some people to nationalism, which helped people to cope with this extraordinary situation and the hardships they were experiencing during the pandemic. And now I want to introduce to you the first theoretical perspectives I used. So as I mentioned, I focused on risk. So I started to read a lot of about risk, and there is a lot of literature really interesting. And I started to have kind of risk glasses on. So I started to see risk everywhere, and not just on a global or on a local level, but in mundane decision-making, individual mundane decision-making. Each time is kind of a risk analysis or calculation of risk avoidance. This was really, really interesting for me. And I recognize that there are two different levels where I want to analyze the risk. There is the macro perspective, which is happening globally, and then the micro perspective, which is the individual and the local perspective or experience of the pandemic and risks. And risk became received major attention in the last 2 decades, also in social science. Among others because of the work of Anthony Giddens and Ulrich Beck. And I focused on Ulrich Beck's Risk Society, where he argues that the society we are living in is a risk society, where risk became the major focus. And he focused his analysis on the macrostructural change which are happening in our time. And he argues that from the 70s, 80s onwards, the traditional industrial society was falling apart. And this entailed decisive structural change on a global and on a local scale. And such changes are also perceivable now, like the change which happened with the coronavirus or the COVID virus had on a global scale, had implications on massive implications on a local level. So he also claims that we are in a reflexive modernity, where the risks and the dangers, they don't derive from nature or from God as in previous societies, but they are kind of a consequence of modernization, like a side effect of this. Such processes as industrialization or globalization enhance these risks which are manufactured by humans. Example for that are global warming or pollutions, the plastic in the oceans, and also, in my eyes, this pandemic. And important in in Beck's risk perspective is that he perceived the risk as objective and real. So a further really important thing in his theory is the cosmopolitization of the world. And by that he means that the risks which are now manufactured and side effects of modernizations are global risks. Thus, this means that they are not contained by national borders or specific areas. They concern the whole world. For example, climate change is not solvable by one country and is not caused by one country. And in these cosmopolitization processes, they need that the people that the different countries collaborate to contain and control this virus. And the pandemic is a wonderful example also for that, where a local crisis somewhere in a food market in China evolved to a global pandemic which concerned all the countries, and which control and reduction needs collaboration between all the countries and in different institutions. So the central focus of this modernity is the risk. And I thought this is perfect. This fits perfectly into my research and in the situation that we were living during the pandemic. But in the second phase of the isolation, I observed that the risk perception started to differ from each other. They started to be different. because before, in this uncertain initial phase, the risk perception was quite similar, but in the second, they started to differ. So here the sense-making processes come in, where people choose between different explanations for something that they don't know, and the information that they derive from outside, such as through media or social interaction. They align this with personal experience and knowledge and create their own idea of, in this case, the crisis. And this is also the moment where conspiracy theories took over the narrative of the pandemic, because people started to reflect and reassess the situation they were living in and created their own theories or their own situations. So also something that was important, this risk perception, which were different. So I realized that it depends, it has many factors why a person experiences something as risky or not, or something else as risky or not. And I have there a beautiful quote that I want to share with you. This person lives on the mountain, and I talked to her, and I asked her about the crisis, and she replied, "We don't have the virus here. I have not noticed the fear which is governing the city, Bolzano. My son, who works in the city, told me that the virus is down in the valley because all people are wearing face masks there." So I like this quote because of two reasons. Because this had shown me that the crisis is not the same. It depends where you are, which conditions you are living, how you make sense of the situation, how you perceive the crisis and the risks. And the second one is she referring to the face masks as there is the virus because people are wearing the face masks. And some weeks after this interview, I spoke to her again, and then she said, "Now we have the virus here because people wear masks in the store." So this is an important, this visual component of the virus is something really important, which coined the whole pandemic. Because a disease, in the medical anthropological perspective of diseases are not just out there somewhere or exist in kind of a vacuum. They always exist in a context in which they manifest. And so the experience of the diseases in a certain context gives meaning through cultural and social structures which are already there. And so the diseases somehow receive kind of an identity. And during the COVID-19 was a novel virus, so the identity, there was no information linked to this virus. This also elicited a lot of uncertainty and fears. But throughout the process, certain characteristics and attributions were given to the virus. And these characteristics and categories elicit specific responses and reactions in the society. So, for example, the categorization of the risk group is a response from the society which decided with scientific knowledge that with 65, you are a part of a risk group. And this categorization made somehow the identity of the virus. The virus is a virus for old people, and we are young, we don't have to care about this, and so on. And the invisibility of the virus was important because if you can see something, something is not risky, something is not dangerous. So throughout the process of the pandemic, the virus needed to be visualized. And this was done by different means. In the beginning, through the graphs, the numbers, and the statistics. For example, the flatten the curve graph is something really important, which made people understand that the virus is risky. And the image of the hospitals in Lombardy showed people the virus is dangerous. People are dying. This was really important throughout the pandemic. And this invisibility is not just that you can't see the virus with your eyes, but also the symptoms are in many people not visible because they remain asymptomatic. And this characteristic of the virus created the category of asymptomatic carrier, which in my observations, become a major driver for people comply with the measures and to perceive the virus as risky, because everyone could be infected and could transfer the virus to another person. And this categorization or this characteristic of the virus elicited a hostile environment among the people, because other people are perceived as risky or bringing risks to yourself. And this was also, or I experienced this myself, when you went to the street, people were really suspicious and hostile to each other because of this characteristic. So, yeah, this differing risk perception started, and this hostile environment started to collide, to crash in each other. And that's the moment also where the conflicts emerged, where people that perceived the virus as dangerous and risky for oneself started to blame people that perceived the isolation as risky and dangerous for their health and went for running. And this created this whole hostile atmosphere, not comfortable atmosphere. And this showed me that there are also other factors. There is not only this macro perspective, as Beck claims, where there is this objective risk of the virus, but there is also a constructivist view of risk, which might be linked to cultural, it's in the environment you're living, your knowledge, your experience. So for this micro perspective, how in the individuals experience the risk, I used Mary Douglas' anthropological approach of risk. She has done a lot of research about witchcraft. And risk became a really important concept in her work. And she perceived that the risk is not something that concerns just modern society, but is something that derives from previous traditional societies and is reproduced throughout humanity. And she observed that certain concepts emerge repeatedly, and they are linked to a symbolic and cultural structures, which are the basic of societies. So one concept that emerged and was quite evident in my eyes during the crisis was the division of inside and outside, and purity and dirt. So according to Douglas, communities preserve and maintain order in leaving the risks and the threats outside their community. So this communities, which can be a society, a city, a family, or also your body, needs to be protected from this which comes from outside, which is perceived as risky and dangerous. This is also connected to blame and otherness if someone is from an outsider from a specific group. And this was also observable in my eyes during this crisis, because when the crisis got real in Italy, obviously they started with the border controls, and subsequently they closed the national borders. So this was the first division between inside and outside, but then the isolation came and people's life got restricted to the houses. So the private house got the inside, which needs to be protected from the outside, because in the outside, the virus was there. So it was perceived as dangerous and kind of impure. And people needed to protect this inside, which they did through rituals. Like, I frame them as rituals, because people needed to prepare themselves when they left their house. So you had to have your self-declaration, your ID card, people will protect their body with gloves and glasses and masks. And also, to continue with this inside outside, the mask is also something really interesting, where the inside is not anymore the apartment, but outside you need to protect your body. And the mask is really a beautiful symbolic object to protect your body from the outside risks. And when people then came back home, they were kind of, they have been to this dirty, dangerous place outside and needed to purify, to clean themselves, to be allowed and to maintain the order inside the house. So people told me about the rituals they perform when they come back. One person told me that she constructed a little triage on the entrance of her home. So when she left, she prepared herself for leaving, and when she came back, she started to clean everything that she had, like change the clothes. Then she took a shower, shoes were changed, and even all her groceries were cleaned. And this is really interesting in this perspective of Douglas, because these people who were doing this or perceived the risk as real. They were really concerned about the COVID-19 virus and perceived it as risky and dangerous for themselves. And the measures, the implemented measures, were not enough for these people. For these people, they even wanted to have it stricter because the risk was real. So nevertheless, the probability to get infected with COVID-19 through the contact of contaminated groceries is quite low. And also the thing with the mask, experts were quite unsure if it really helps the virus spread or not, especially in the beginning of the crisis. So this cleaning rituals and these new practices helped people to reduce their risk perception, because in doing so, in this whole uncertain circumstances, they perceived that they were reducing the danger and the risk for themselves. And Rode is referring to these practices as kind of magic. And also Alesevsky used this magic concept in his research about risk, and this kind of magic rituals are not just evident in this COVID crisis, but in our everyday life. We just don't recognize it as kind of a magic. And I think this is what I wanted to tell you about. No, I have another idea. And then this with the magic. So you could also see people who stayed to comply with the measure and remained at home. This kind of a magical practice, because with being at home and complying with the measure, they reduced their fears and their uncertainty, and had kind of an order in their life. So these are the insights into my research. I want to finish with some concluding words. I hope I'm in time. So in the research, I perceived that there was this objective risk and the constructivist risk, and they both were linked to each other. One could not exist without the other. And the objective risk of COVID-19 is really important. And I think the situation that we are living is quite aligned with the risk society that is, which was argued by Beck, because it was caused by globalization processes, made this pandemic possible. And yeah, like the back and the objective is really important and made this happen. But then you have this other perspective, is the constructivist, which made the individual perspectives. And in my eyes, during the implementation of the measures, this constructivist approach was a little bit neglected. So we had this objective risk of COVID-19, but in the discussion in the public narrative, there was no space for other risks which were already there before the crisis, or even which emerged throughout the crisis. For example, being in isolation, facing domestic violence at home, having like a lot of other risks which emerged during the situation. And I think this was this should be important if something is implemented, such as these measures, because neglecting the other risks which are still there or emerge from the isolation could have put or can put people in extreme complicated situations and in also dangerous situations. For example, in South-Tyrol, the suicide rate increased decisively in the last weeks. So yeah, my final words are that there is this objective notion of risk within COVID-19, but we don't have to neglect the constructivist approach, and we have to merge these two approaches, because otherwise we have the danger that we neglect other risks which are always out there. And I think the harm caused by the reduction of risk should never increase the damage which is elicited from an objective risk as it was by the COVID-19. So this was my final word. Thank you for listening. Now, normally the slide. Thank you for listening.
Okay. Yeah, many thanks, Julian, for this interesting and enlightening talk. I would like to open the question time right away. So if anybody has some questions in, as I said, in English, German, Italian, maybe even Portuguese. Okay, Daniela.
So first, thank you very much for your presentation and for telling us all these experiences, also your own experience and